Can we talk about what each part of Medicare covers and what people could potentially expect to pay out of pocket? I mean, you already referenced A, hospital, B, we know is medical, D, prescription drugs. We even talked about Part C. That's Advantage, right? Advantage plans. Yeah. What can people like standard premiums, deductibles, co-insurance amounts, like how do they vary? What could people expect?
Yeah. So it's going to depend on a couple of different things, but there's a few that we can count on, right? So we know that Medicare Part A, like I mentioned, if you worked your 40 quarters or your spouse has worked 40 quarters that you can draw on, you're good. You're not going to pay anything for Medicare Part A. That's the hospital portion. The way that some of our team references it as is if you're in the hospital, it's the bed that you're laying in, it's the Jell-O on your plate, and it's the nurse that brought it to you, right? So yeah, like that's one way we hear Medicare Part A referenced is it's hospitalization.
Yeah.
Medicare Part B, it doesn't make any sense, but it's medical, right? So this is doctor's visits. These are, outpatient surgeries, things along those lines, surgical.
Yeah.
Anything that you have done in a doctor's office is going to be, subject to Medicare Part B. And so that's that portion of it. Durable medical equipment falls into that as well. So that's Medicare Part B. Medicare Part B has a premium, right? And so this is one of those ones that's pretty standard. The standard Medicare Part B premium in 2025 is $185 per month.
Okay.
Right? So you start Medicare Part B, you're going to start paying $185 per month.
Cole, do you know 2026? Now we're recording in 2025, but I believe this is going to air in 2026. Is it going to be slightly inflated?
Typically, yes.
Okay.
Typically, the premiums will go up for Part B every year. If you're drawing Social Security, it's going to come directly out of your Social Security check.
Okay.
If you are not drawing Social Security, you're typically billed monthly for it, right? So you're billed, you can send in a check to Medicare.
Okay.
If you have IRMA applied, which is the income related monthly adjustment amount, if you're a high income earner, I don't want to get too far into the weeds, you're billed quarterly, right? So there's all kinds of different ways, but you have to pay for Part B.
Okay.
Medicare Part D, as in drug, it's the only one that makes sense, is prescription drug coverage.
Yeah.
We can talk a little more about that because that's an important one that someone should review annually. And then Medicare Part C, I always reference that one last. Medicare Part C is Medicare Advantage. This was rolled out in 2006. This is something where you're going to have all of your Medicare benefits, A, B, and D, smushed into one, right?